Hello, I'm Rebecca Mullenberg, and I'll be the occupational therapist working with you today. You must be Lisa?
Yes, I'm Lisa. Nice to meet you.
Nice to meet you too. So, have you heard about occupational therapy before?
Yes, it's similar to physical therapy, am I right?
Yes. Occupational therapists work with injured patients to help them get back to doing the things they love to do throughout daily activities. So, I'll help provide guidance on pain control and safe hand strengthening exercises when you're ready. Does that make sense?
Yes, thank you so much for explaining.
No problem. And thanks for meeting virtually with me today. I just want to spend about 10 minutes with you going over your wrist injury today. I understand that you suffered a fall at work at the bridal salon and you were given the diagnosis of scaphoid fracture in your right hand by your doctor last week. Is that right?
Yes, you were right. I love working with brides, but those dresses are so heavy. And I just lost my balance and I tried to catch myself, put my hand out, and I did see the doctor and we did an x-ray and he did put me in a splint.
Oh, wow. I can see how that would be easy to do. I'm glad that it didn't end up any worse. And I'm glad you have a split now for stability. Thankfully, you didn't end up with a displaced fracture, so you won't be needing any surgery. So we're just going to start off by going over what that diagnosis means. And if you have any questions at all at any time, feel free to stop me and ask.
Thank you so much. I was so thankful that I didn't need surgery. I was so worried about that. And I want to get back to work as soon as possible. I so miss it. I'm just dying to get back to work.
And I'll do my best to get you back to work as soon as it's safe to do so. So you should have received an email just prior to the session with a handout of the overview about scaphoid fractures. Are you able to pull that up right now?
Um, Let me pull that up. Oh, yes. I'm looking at it right now. It's so helpful because I don't really understand exactly what I broke. I mean, my doctor tried to explain it to me, but I really can't remember what he said.
Yes, I can help with that. So while you're taking a look at the handout, I'll give you a brief overview of the injury and structures involved. So a scaphoid fracture is one of the most commonly fractured bones of the wrist, and it often occurs when someone attempts to catch themselves with an outstretched arm, which causes a break in one of the small 8 bones of the wrist near the base of the thumb. So right here, do you see that in your picture too?
Yes, thank you. That's exactly what I did. It is so crazy. I knew I shouldn't put my hand down, but it was just a natural thing.
That's all right, it happens. So symptoms usually include pain, swelling, and tenderness just below the base of the thumb. Is that where you're experiencing pain?
Yes, and it does get worse when I try to pick something up, but it really doesn't look like my wrist is broken.
Yeah, it's common that pain worsens with pinching and grasping motions of the hand. So it's best to limit those movements if they cause pain at this time, since you just got injured last week. And fractures usually don't show any physical deformity, so that's why your wrist may look normal. It's good to remind yourself that it is in fact injured.
Oh, yes. Thank you so much for explaining this to me. I can limit grasping for now, but not for long. So how long do you think it's going to take to heal? Because I really would like to get back to work, but I also want to get back to baking and biking, my hobbies. And that puts a lot of pressure on my hand.
Again, thankfully you won't be needing any surgery, so this fracture, the healing process will be a lot quicker. And it may be as little as 6 weeks, but usually it takes about 12 weeks. However, because the scaphoid bone has low blood supply and blood is required for healing, it may take longer. Different for everyone.
Do you think that I'll be able to get back to movement like eventually? I need to be able to lift those dresses off the rack.
Yes, absolutely. With proper treatment, most return to complete functional use.
Oh, that really makes me feel so much better. Thank you so much. I'm really motivated now to get started and to heal. And as soon as it works out with your schedule, I want to get back to treatment as soon as possible. Well, what will that look like?
Well, because you're diagnosed so early and your fracture doesn't require surgery, treatment is actually fairly simple. Your fracture is also closer to your thumb, which is an area with better blood supply, so it should heal up nicely. However, you may experience some wrist stiffness, and it's important to maintain your full finger motion throughout the recovery period without putting too much strain on your wrist. In occupational therapy, we'll work on exercises that focus on strengthening, stretching, and maintaining as much range of motion as possible. Don't worry though, we'll start very gently and progressively make these exercises more challenging as you get your strength back. We may try using some weights as well. But we'll talk more about how we can implement these exercises into your daily routine during our next session.
Oh, thank you. That sounds good. Can you give me an example of what an exercise might look like?
The one stretching exercise we'll works on range of motion. So it involves gently moving your wrist from side to side like a handshake, like this, and holding for about 5 seconds in each direction. This may be uncomfortable, but it shouldn't be painful. So if you're having any pain, make sure you let me know and we'll stop the exercises.
Awesome. That gives me a better picture of exactly what we will be doing. I have a question for you. What should I avoid doing in the meantime?
Yeah, that's a great question. For now, focus on wearing your splint until it's fully healed. And during this time, avoid lifting, carrying, or pulling more than a pound of weight. And also avoid throwing anything with your injured arm or climbing ladders or stairs or participating in sports that have a high risk of falling, like biking. I know you mentioned a love for baking and biking, but you should probably limit those activities for now unless absolutely necessary. You should also plan to not lift any heavy dresses until it's healed. I'm sorry about that, but it's what's best for your safety.
I understand. I do not want to re-injure it. That would be so bad. Are there any other things, any other precautions that I should take?
Yeah, I'm glad you asked. Scaphoid fractures can come with some complications if not treated correctly. Because of the limited blood supply to the wrist, it's possible that you may experience a non-union, which is just a fancy word for failure to heal. So if this does become a problem, your doctor may consider surgery to promote healing. Another complication may be arthritis of the wrist, like aching or stiffness or pain. However, I'm not suspecting these to be issues for you because you were diagnosed so early. With proper precautions and finger exercises, you should be getting back to doing the things you love, like baking and biking, very soon. Make sure to wear your splint until it's fully healed as well. This will help a lot. If problems do arise in the future, like excessive pain or swelling, please let me know right away to address it early.
Thank you so much. That all sounds very doable. I have another question. Is there anything I can do for the pain right now?
For pain management, your doctor may recommend taking an anti-inflammatory medication, but you can also try icing the area or elevating your hand to heart level to reduce swelling. But rest is the most important factor for your recovery right now. I know COVID has changed a lot of everyone's daily lifestyles, and you're spending a lot of time inside. But please do not rush back into biking and baking if you have pain, because this may lead to lack of healing.
That all sounds great. Thank you. I do like the idea of being able to do exercises at home right now because of this COVID situation. I don't even know when the bridal salon will open. It might be June 1. So I'm taking some time off, but thank you so much for all your help today. It was so helpful.
Yeah, no problem. Any other questions or concerns you have for me?
I don't think so. It's nice to still be able to recover without going to the hospital.
And thank you so much for being willing to meet with me virtually. Hopefully, I'll be seeing you in person soon. In the meantime, please stay safe and healthy and have a good day. But one more thing, right before I go, I'd like you to jot down 3 of the precautions we talked about to remind yourself throughout the day. Do you think you can do that?
Yes, I did take some notes. The first thing I did was I have to wear my splint.
Mm-hmm.
The next thing is I need to limit those activities that cause pain. And then let me see. Oh yeah, the next thing was do my finger exercises.
Very good. Yeah.
Good.
All right, I'll see you for our next session in about a week, okay? Have a
Thank-
good rest of your day, Lisa.
Thanks for your help.
Yep.
Bye.
Bye.